Hi, I'm Shelly Nielsen. I'm one of the sponsors here at BIZAA, and I'm here with Okey, and I want to welcome you back to Minnesota, back home from Nigeria. And as you're going to see, I have a number of questions here in front of me.
I can see that.
People are so excited. The sponsors and our donors are very excited to hear some news about the trip. So if you have time, we're just going to shoot through a couple questions that are on people's minds. The first one is, our sponsors and donors are very interested in the health and welfare of our BIZAA kids. Can you tell us how the students are doing and if they're back in school?
Wonderful. Again, my name is Okey, and I just got back from Nigeria a few days ago, and I am happy to be home. I'm an American citizen, so I can say that, but I also was coming from home. The students, BIZAA children in particular, are doing very well. Since after the first COVID case that we had during the lockdown of a BIZAA child and her family, we've never had any other case of COVID. None of them right now, out of the 240 something kids, zero COVID. Well, having said that, we believe that when children are trusting and have no other source of support, that God has a way of taking care of his own. And these children are being taken care of, I can tell you that. So they're doing well.
Great. So let's talk about COVID for just a little bit. How has COVID affected the school systems, including our vocational school? Do the students have to wear masks? Do they have to social distance? What would happen if a child did have COVID? Would they need to quarantine like we do here in the United States?
So quarantine, yes. If a child has a COVID, in private schools, remember BIZAA children are in private schools. In public schools, there are no test kits. So they might have COVID and people might think they just have a cold. And so for the private schools where we have our children, there is some structure, and we really appreciate that. So they have test kits that a child who has COVID is asked to stay home and quarantine, and the family is tested. Now, for BIZAA children, because it's not just the school that they're in that is structured, most of these schools are Catholic schools that are also additionally structured because the church has some kind of oversight in their schools. Some other private schools, the owners want to maintain their good name and good record and ranking, and so they also do more in addition to what the government says they should do. So our children are in safe hands like that. For children who contract COVID, who are BIZAA children, the plan is in place. The first one, we weren't quite ready, but thank God that the pastor of the community stepped in with BIZAA Nigerian staff, and they were able to take care of them until the family was okay. But for now, the plan in place is that whenever a BIZAA child contracts COVID and tests positive, that the pastor or the owner of the school has to alert us and let us know whether it is beyond what they can handle. And if it's beyond what they can handle, then we will have a way of supporting from here. The priests who are in the parishes that own some of the schools, at least the first instance, did a second collection to come up with medication and all that. So we have things in place, plan A, plan B, before BIZAA gets alerted if it's a serious case.
Well, I'm actually going to jump to a question, because there was a question about if children or staff, so let's talk also about staff, because we have a lot of staff with the BIZAA organization. If they should contract COVID and need more medical help, is there a plan in place then to pay for that? I hear you say that there was a second collection done, but would we also be helping to support that to make sure they get the medical help they need?
That is part of the information I'm bringing back to the board. Prior to my trip, there was none in place.
Okay.
And so I had our normal reunion with these children, and this question came up. What if we get so sick that we can't do anything about it? And I said, I think I have an answer, but let me go back to the governing board. So we can't continue if we have, say, there are schools that we have over 20 BIZAA children, like Holy Trinity. And if we have 5 BIZAA children at a time with COVID, we can, I don't know how much second collection a countryside parish will do that will take care of them. So So I will bring that up to the board and see what we can do. I think we also owe it to the sponsor to say to the sponsor, your child has COVID, and if any other thing, pray for him or her.
Perfect. Okay, we know that the pandemic is affecting everyone in the world. We know that. And you've talked a little bit about the fact that we've been very fortunate that we've only had one child that's had COVID up to this point. Tell us a little bit about how do you see the pandemic affecting everyday life in Nigeria? Now that you were just there, what does it look like?
For those of us who have traveled to Africa, we know that people, even normal Americans, have just a very short span of patience for anything like a pandemic. So my experience in Nigeria is that people are just getting tired of the whole lockdown scenario, or don't do this and don't do that. If you land in Nigeria, if you walk into the airport, you have to wear a mask. If you leave the airport, you're on your own. Nobody cares. So for some reason, people are not dying as much as they're dying here from COVID. COVID is real, they understand it. At least I sang it like a song to my family. Everybody has to be careful. But it's not, people are not taking all the precautions they should be taking about COVID, especially in public places. That was my observation.
And it sounds like it's not mandated.
It's not mandated there.
Okay.
No, it's not mandated. But hospitals, airports, private schools, mandated. So BIZAA children wear masks in their schools.
Okay.
Yeah.
Okay. Let's just talk a little bit about the healthcare system in general in Nigeria. Are hospitals and clinics close to our kids and our families and our staff? And do our families actually have medical insurance? Or kids have medical insurance if they should access a hospital? And I guess the other question is, how about vaccines? Are vaccines available for our children and the staff?
That's a very good question. So there has to be, at least from my observation, some level of sensitization for people to submit themselves or agree to be vaccinated. Okay. The vaccines are there, people are not accessing them because they feel that somehow what is being dumped in Africa is what has been rejected in the Western world. There is this whole propaganda, for the want of a better word, about depopulating Africa. And so if there is a pandemic and there is a vaccination, the vaccination mask is probably going to make the men and women sterile. Mm-hmm. And so that's why I talked about sensitization, for people to know that the vaccination works. It's not meant to depopulate. If you see something suspicious, for instance, there was some time in the social media where the vaccine bottles are written for export only, not to be used in America, Canada, or Europe. And then you take that kind of thing to Africa, and they're going, so you don't want it in your country and you bring it to us. Mm-hmm. So that really almost killed the campaign for vaccination upon arrival. So now the government is now trying to sensitize or desensitize people, as the case may be, about taking vaccine. The second question about whether they have accessibility to healthcare and insurance, zero insurance. There's no health insurance at all. You're on your own if you get sick. If you have a good job in the city, yeah, you might have insurance. But the countryside where most of our children are, zero insurance. They get sick, the parents cannot handle it, the parish cannot step in, BIZAA cannot step in, then we have a problem. Okay. So the hospitals are there too, or the clinics, but the question is how equipped are they and how competent are the medical practitioners?
And I'm sure, like we're experiencing here in the US, strapped right now with resources.
Yes.
Right. Okay, I know you always have wonderful stories to tell when you come back because you've had opportunity to see our kids and our staff. Will you just spend a minute or two with us and maybe give us a story or two?
Well, there's so many stories, so I'm going to keep it short. And so I have shared with a sponsor at least, and I'm waiting to see the other sponsor, whose sponsored children came up to me when I went home and said, I have a boyfriend now. And it almost, if you walk in my shoes, it was an emotional experience because both the sponsors and these two girls, we know, myself and the sponsors, we know where they were when we got them. And to be so mature and responsible, to know how to love, how to give and receive love, to the point of being bold enough to introduce these young men to me, it was very humbling. And so that's a progress report in itself. We want them to do well in school, we want them to do well spiritually, but when they are doing well socially as well, that's a big, big deal. That two of our daughters have boyfriends, official. We've had one who got married and had a baby. So I mean, we have two in line now. Who knows, I'm going to be a grandpa again soon.
That sounds great.